Hello, everyone. Thank you so much for joining us today. We're going to get started in just a couple minutes here as we let people into the room and people start joining us. My name is Stephanie Lackey. I am the Digital Communications Specialist at the Public Health Law Center, and I'll be providing tech support on today's webinar. Just a few logistics before we get started here. We are using the Zoom webinar format, so all attendees are muted. Questions will be held until the designated Q&A section at the end of the presentation, but you can feel free to submit them at any time. To do so, you can submit the question with via the black Q&A box at the bottom panel of your Zoom window. There will be a webinar evaluation survey that will pop up as you exit the webinar. We really do appreciate your feedback, so if you could just take a couple of minutes to complete the survey after the webinar, we would really appreciate that. Also, this webinar is being recorded, so if you missed details or would like to share it, a link to both the slides and the recording will be available on the Public Health Law Center website, usually within 48 hours, and all attendees will receive a follow-up email with that archived link. So without further ado, I'll introduce today's moderator, Carrie Cork.
Thank you, Stephanie, and hello, everyone. I'm Carrie Cork, Senior Staff Attorney at the Public Health Law Center. Thank you all for coming to our webinar today, Changing the Game, a playbook for e-cigarette regulation at the state and local level. We think this is a particularly timely webinar because only a few weeks ago, the CDC released an annual report showing that e-cigarettes are rapidly increasing the number of people, especially young people, who use tobacco products in the US. In light of the lack of strict federal regulation of e-cigarettes, state and local governments are stepping up to regulate these products themselves. Our webinar today showcases many regulatory options for policymakers and public health professionals to reduce the e-cigarette epidemic sweeping our nation, particularly our country's youth. So we're also delighted to announce today a new policy playbook for e-cigarette regulation at the state and local level, delivered by experts at the University of North Carolina and our Public Health Law Center. Before I continue, I need to point out this webinar is hosted by the Public Health Law Center, a national nonprofit network of legal centers and attorneys that support public health and tobacco control policy at the local, state, and national levels. We do this by providing free legal technical assistance to public health advocates and professionals around the US in several ways, through legal research, policy development, implementation and defense, publications. We have a wealth of resources on our website at www.publichealthlawcenter.org, trainings such as this one. And I do need to point out that we don't represent clients in court and we don't lobby. Finally, our organization is committed to the principle that good public health cannot be achieved without addressing health equity. And I do want to point out before we get started with the introductions that this webinar is probably going to end up going over 60 minutes. We may end up going to another 10 to 15 minutes because we have a wonderful panel, 5 speakers. And our first presenter is Kurt Ribisl, who is the Joanne Earp Distinguished Professor and Chair in the Department of Health Behavior at the University of North Carolina's Gilling School of Global Public Health at Chapel Hill. Kurt is also the program leader for cancer prevention and control at UNC's Lineberger Comprehensive Cancer Center. Our second presenter from UNC is Hannah Prentice Dunn, who's program manager at UNC's Lineberger Comprehensive Cancer Center. Hannah has worked for 10 years in clinical trial management, public health program delivery, and cancer prevention research, both in New York City and in North Carolina. She and Kurt will talk about UNC's vaping prevention resource and introduce a new publication that their project and the Public Health Center developed for state and local governments seeking guidelines to regulate e-cigarettes. The e-cigarette policy playbook. Our next 2 speakers, Kira Hill and Julie Amajuoyi, are staff attorneys at the Public Health Law Center and co-authors of the e-cigarette playbook. Both Kira and Julie provide legal technical assistance to public health professionals and advocates working on commercial tobacco control policies throughout the United States. They're also part of our California State Tobacco team. In addition, Karen is an environmental attorney and works on our center's FDA project, where she closely monitors the federal regulation of tobacco products, including e-cigarettes. And Julie serves on our Minnesota State Tobacco team and has a strong public interest background, as well as a graduate degree in theological ethics. Kira will give a quick overview of the background of federal and state e-cigarette regulation and policy basics, and Julie will give a brief bird's eye view of the range of e-cigarette policies. Finally, our last speaker is Megan Kenny, who's health educator in Santa Barbara County's tobacco prevention program. Megan has years of experience in public health policy and research and will help pull everything together by describing Santa Barbara County's experiences in adopting many of the e-cigarette policies we've discussed. She'll also share her community's takeaways following e-cigarette policy implementation. So without further ado, I'll now turn over the podium to Dr. Kurt Ribisl.
Great. Awesome, thank you so much. We're very pleased to be able to talk with you about the resources that we're developing. We have a new website called the Vaping Prevention Resource, and that is going to be hosting this playbook that we're talking about. As you saw, Hannah Prentice-Dunn is one of the three co-leads on developing our Vaping Prevention Resource website. Dr. Seth Noor, who's not here, who's a professor at the UNC's School of Journalism and Media. And you can see my information there as well. And I've been doing tobacco control work for about a little bit over 25 years, and was on the FDA Tobacco Products Scientific Advisory Committee. Other members of our team are listed here. They're from our Cancer Center, from our School of Public Health, their students, their staff, and they really helped us pull together this particular website. So just a teeny bit of background about our group at UNC. We've been doing e-cigarette research for over a decade, and there was a really interesting study done by Rutgers of the place that were the most prolific in publishing on e-cigarettes, and they ranked UCSF #1, Hopkins 2, and our UNC group #3. We have been doing, we have 91 publications over the last decade and a half. Dr. Jessica Pepper, who's now at RTI, Dr. Pepper, I think might have done the first dissertation on e-cigarettes. And we have 4 R01 projects. I'll just mention a couple in a minute, and nearly $9 million in research funding to look at e-cigarettes. We really spent a lot of time and focus on this particular product. And here are some of the researchers. Dr. Noel Brewer, who's in the School of Public Health, has 2 R01 grants. One of them is looking at e-cigarette warning labels. I'll show an example in a moment, but right now we currently have just very modest text-based warnings, and we need to be thinking about better, more comprehensive warning labels. And he has a new grant with an advisory board that we've been regularly meeting with, and we've got new prototype warning messages that we hope that we're going to be that have been tested in other trials, but we've got a series of new ones that we think have potential for adoption at the federal level. He's also working on a new project of people who have high levels of vaping that are beyond what they really, it's called uncontrolled vaping, people who use a lot. Like a cigarette has sort of like speed bumps. At the end of the cigarette, it's done, or the end of the pack, you're done, and there's sort of like a natural closure. But with vaping, there's a subset of people who really are using very high amounts, and he's got a new study looking at that. Next, I work on the Aspire study, which is a focus on the retail environment with Dr. Lisa Henriksen and Jody Prochaska at Stanford and Dr. Doug Luke at Washington University in St. Louis. And our focus is really on the retail environment, including vape shops and e-cigarettes. Seth Noor's got a really cool study on vaping prevention messages using text messaging. And there are not many programs right now if you want to deliver a media campaign on vaping prevention to adolescent youth. And so that's really exciting. Dr. Shelley Golden's doing some work on when people move to different places, how their smoking changes. It's a really cool longitudinal study. So if you move to a place that has has very low smoking, has very low cigarette taxes, and the state you move into has really high taxes and strong smoke-free air laws. And within the next year, what happens to your smoking behavior? Or the reverse. She's doing a really cool study looking at policy environments. Dr. Sarah Mills doing a really comprehensive study, synthesizing all the literature on menthol bans, what impact they have, particularly on disparities. If FDA implemented a national ban, what would happen with cigarette ban? How would cigarette use be affected? And also, could it close the gap between Black and white adults in lung cancer mortality? So it's very exciting. And finally, Dr. Adam Goldstein looking at little cigar and cigarillo warnings and finding optimal warning, because that's another place too where we can do a better job of warning labels. This is just one of the examples, some of the types of warnings that Noel Brewer has developed in the team, but you can see the text-only ones. The one in the upper left, that this product contains nicotine, is currently what the FDA requires. But then you could test out, you could take the same text messaging, text language, and then add an image to it. We found that compared to a control, they do encourage people to express interest in quitting if they see these e-cigarette messages. In the paper, we recommend that probably at this point, maybe just text-only messages might be the way to go, and not go yet to the pictorial, but really the pictorial ones, which work very well, should be used for cigarettes, the most dangerous and dirtiest combusted tobacco product out there. Next. So here's a little bit about the rationale for creating the vaping prevention resource. We get asked a lot, like, what does a community do? Where can I find in one place what a local community should do if they're concerned about e-cigarette use and vaping in their community? So, and how do you communicate about it? So that's the focus. There's a fantastic website at Stanford that's looked on curriculum for schools that Bonnie Helpern-Felcher has done. That's excellent. This one, and there's other sites that have different angles, but we're trying to be a very comprehensive site that helps you look at communication messages. Hannah is going to take you on a tour in just a moment to show you some of the types of messages that we've collected. We think it's the largest collection of vaping related messages anywhere in the world. And so this puts it in one central place. And also, people wonder, like, what kind of policies should be put in place? Where should I start? Should I start with a retail licensing regulation first? Or should I go to a tax? Or should I go to clean air regulations or flavor restrictions, et cetera? So really helping, people have said, I'm really confused. It's kind of overwhelming. Where do we get started? And so that's where the vaping prevention resource comes in. So we do have more of a focus on the health of young people. So that's our vision, where vaping is no longer a threat to the health. And our mission is giving communities the resources and information to respond to the vaping epidemic. We have three main audiences, but the primary one is practitioners, okay? And so we've created a media gallery and guide that you'll see in a minute, that just catalogs from all over the US and world the different types of approaches that people have used in their media campaigns. And it's social media, it's print media, it's billboards, it's digital, and everything. We also have health communication guidance. So how should you communicate, and what would you do around explaining? What type of framing should you use when you're talking about this issue? Researchers are a secondary audience. And so we already have several researchers who've been looking at this database that we've compiled. How are people, what are some of the, the framing strategies? They're taking some of the images from it and having people respond to them and seeing which ones seem to discourage vaping the most. So it'll be useful, I think, for researchers and also policy advocates who want tools for change. And that's where this, the Playbook is going to come in, because it's our sort of compilation, and we're also looking at profiling the work of other people. So as people have vaping materials and you want to send them to us, we would love to be a place where we catalog all of this work. I had started years ago with a website, Counter Tobacco, that I co-founded with Allison Myers and was really trying to pull together information on point of sale work. And so this was now one to do one on vaping. Here you'll see just a short snippet of it. Hannah's going to show you more, but allows you to pick the format. You can see really what's out there. So many people, we don't want to reinvent the wheel too much because there is a lot. We've found hundreds and hundreds of messages and different strategies for vaping. And so these are the ones that by cataloging it, it's the first step in trying to figure out what really works, what's best, and people can use it as they're shopping to say, hey, I might want to use this particular approach, or we can design ours off of that prior program. Now the playbook is where we put in one place where we reached out with our colleagues at the Public Health Law Center, who are, is one of the, it's the, leading group focusing on policies and recommendations for at the local, state level, as well as federal level. But here we're talking mainly toward local and state regulation for the playbook. It's really, practitioners have been saying, what do we need to do at the local level? What policies should we do? What's legal? Because some of the policies that you might want to do are not necessarily allowable, and you're going to hear the attorneys telling you about that. And also some advocacy resources that really will help you as you're making the case for regulation in your community. Thank you.
Great, thanks, Kurt. Now I'll be jumping in to give you a very quick overview of the website and also let you know about the resources that we have for your communities. And at the end, I'll show you where you can download a full PDF of the playbook that we'll be discussing today. So as Kurt mentioned, our goal with Vaping Prevention Resource is to provide a hub of high quality, evidence-based information and resources that you as public health practitioners and stakeholders in your communities can actually use to combat the vaping epidemic, and in particular, the vaping epidemic among youth. And as you see from the menu on our website, we offer resources across a host of areas in vaping prevention and control, but I'm going to be focusing in on these 3 pages. We know that the communication, the science, and the policy around vaping prevention is rapidly changing, and our team is digging into those areas and really distilling that information to give you actionable tips and resources that you can use on the ground. As Kurt mentioned, this is our media gallery, and we are looking across the country at public health campaigns that are addressing vaping prevention and cessation. We're organizing them and we're parking them in one place so you can browse through them. You can use the filtering system on the left-hand side of the screen to find ads that interest you, maybe touch on a certain theme that you're interested in, or that target a certain population. You can also use the search bar at the top of the page. And a quick note here that we are continuously updating this page. There's lots of content out there, so definitely check back for new additions. Here's some examples of some of the ads that we have in the media gallery. We have 4 different kinds of media items, including videos. We have GIFs, as you can see on the screen, the skull and crossbones. We have images, both for digital and print, and we have posters as well. So when you pull up a specific item in the media gallery, this is a view that you'll see. You'll see a host of information on that item, including the source organization, a brief description, and a direct link to the organization that produced the image. And I also want to note that we do have a question here at the bottom of the screen. As Kurt touched on, we really don't have enough information about what ads are effective. So we're taking sort of a scientific approach to crowdsourcing this information. So this question is open to the public. As you go through the media gallery, we definitely invite you to evaluate it, give your quick evaluation of the ad, and hopefully it's kind of a fun thing to do as you look through the media gallery. We know that the science of vaping prevention, and particularly how to communicate with adolescents and adults about vaping, is rapidly changing as well. So on this page, we are offering summaries of the strongest evidence around the harms related to vaping. We have updates on the vaping epidemic itself, but we're also providing what experts in the field are currently thinking about and their tips and recommendations for policymakers and also practitioners in the field. Our UNC researchers are working a lot right now on how to communicate effectively around vaping. And as that science builds, we will post new content on this webpage. And last but not least, and the reason why we are all here today, is the policy playbook. So this is the policy page on our website, and it's where you can download the full PDF of the playbook, and you can also see detailed summaries of different sections of the playbook. The Public Health Law Center is also hosting the playbook on their website. The hyperlink is here, and you can see that it's posted under their resources on their e-cigarettes page. And we'll of course make sure that all webinar registrants receive these links so they can download the playbook. And as I wrap up, I just want to underscore that we've created this website to support your work and to combat the vaping epidemic in your communities. And so we definitely want to hear from you and what you need. So during today's webinar, if you have ideas of information or resources that would be helpful, please send that to us in the Q&A, and also contact us via email, and our email address is up here on the screen. So please visit our website, and we're looking forward to sharing more about the playbook with you. Thank you.
Great, thank you, Hannah. So with that, I'm going to dive into some of the specifics of the playbook. And first, I'm going to talk about the well, first of all, my name is Kira Hill. As Carrie said, I'm a staff attorney at the Public Health Law Center. So today I'm going to delve into some of the background components of the playbook, including the federal regulatory context, and then some of the basic elements of policies. Then I will turn it to Julie to talk about specific policies discussed in the playbook. And then Megan will provide some of her on-the-ground perspective and experience. Next slide, please. So first, we're going to talk about the federal regulation of e-cigarettes. Next slide, please. In 2009, the Family Smoking Prevention and Tobacco Control Act, or the Tobacco Control Act, required the FDA to regulate cigarettes, smokeless tobacco, and roll your own tobacco. For any other product that is made or derived from tobacco and intended for human consumption, the FDA has to deem those products subject to its regulatory authority. Next slide, please. So in 2016, the FDA issued the deeming rule, meaning that up until that point, FDA did not have authority to do anything about e-cigarettes. The FDA's Tobacco Product Authority includes pre-market review of products that looks fairly similar to the FDA's Drug Authority, which allows a product to enter the market only after it has been authorized for sale by the FDA. So once e-cigarettes were subject to the FDA's jurisdiction via the deeming rule in 2016, the products were supposed to go through pre-market review before they could be sold, but that is not how things have been implemented. Next slide, please. Even though the deeming rule should have required e-cigarettes to undergo pre-market review, the FDA ultimately decided that e-cigarettes could stay on the market for several years beyond when pre-market review was first required for them. In fact, the FDA's initial plan was much more lenient than the one pictured on this timeline, but luckily public health groups sued the FDA and successfully got the timeline moved up. So in September of this past year, September of 2020, manufacturers were required to apply to the FDA for marketing authorization. By September 9th of next year, of 2021, FDA authorization will be required for products to stay on the market. Yet, since August of 2016, the FDA has been using its enforcement discretion to allow all e-cigarettes to remain on the market with very little oversight. It could have, at any time, ordered any e-cigarette to be removed from the market and forced the manufacturer to apply for a specific authorization to re-enter the market. So pre-market review is an incredibly powerful tool that the FDA has not used effectively. Next slide, please. So let's talk a little bit about what that has looked like on the ground. First, as you're probably aware, Juul voluntarily removed mango and other flavors from stores towards the end of 2018. And then a few months after that, the FDA proposed to take action on flavors in e-cigarettes. Then Juul voluntarily removed mint from its shelves about a year later. And then again, shortly after that, FDA issued its guidance effectively mirroring Juul's efforts. So this isn't to say that Juul is somehow the good guy here. Rather, it illustrates that the general theme in FDA regulation of e-cigarettes, that when the FDA has acted, it simply followed the industry's lead. And I would argue that this is not what effective regulation looks like. This is what industry self-regulation looks like. Next slide, please. There are a couple additional pieces to understand about FDA's lackluster efforts to regulate e-cigarettes. In its guidance issued in January of 2020, the FDA made a distinction between cartridge-based e-cigarettes like Juul and disposable products like Puff Bar, which hopefully people are pretty familiar with. Even if you don't know what Puff Bar is, what you need to know is that products like Juul sell their devices in cartridges or pods separately. The device is rechargeable, and you buy additional pods to insert into the device, and then only the pods are discarded, whereas the device is recharged. With disposable products, the device and the pod are inseparable, and once the nicotine is used up, the entire unit is discarded and the user buys an entirely new device that is pre-filled with nicotine. The devices operate slightly differently, but they're not used differently by youth or adults. Despite this, the FDA has decided to treat them differently. Next slide, please. For Juul and similar devices, the FDA focused its enforcement priorities on all flavors except for tobacco and menthol. However, for disposable products, the FDA has allowed all flavors to remain on the market. But also note that the FDA's action is inherently temporary because the FDA is using its discretion to prioritize enforcement under its pre-market review authority that we talked about earlier. It has forced Juul and other companies to remove their products from the market for the time being. However, the companies are free to apply to get authorization from the FDA to market these products again in the future. It is possible, if not likely, that in the future, the FDA will authorize the sale of flavored e-cigarettes like Juul. So while I would argue that it would be contrary to FDA's statutory public health focused mandate to allow the marketing of Juul Mango again, it's possible that it could come back if the FDA allows it. Next slide, please. To provide a visual representation of how FDA's efforts to regulate e-cigarettes has fallen short, let's just look back at the FDA's efforts since 2016. Deeming, which was effective on August 8th, 2016, should have prevented new products from entering the market without pre-market authorization. I'm willing to bet that most folks working to reduce the harmful use of commercial tobacco can think of at least a few e-cigarettes that came to the market after that date. But even if you can't, let's look at it this way. In August of 2016, Juul's market share was minuscule. At that point, Juul was a fairly new product and was not outselling the big tobacco companies. Yet, as that big red bubble, which is sales of Juul, grew, all of the large cigarette and e-cigarette manufacturers introduced products similar to Juul, and they all entered the market after August 8th of 2015. Next slide, please. Further, FDA's enforcement of the presence of illegally marketed new products has been lackluster. FDA has sent a handful of warning letters to e-cigarette manufacturers regarding products that entered the market after 2016, but the only company among them that you've probably ever heard of is Puff Bar, which came under scrutiny by public health groups, Congress, and the media after it became the replacement product for Juul after Juul discontinued the sale of most of its flavors. Again, however, the FDA's action came only after Puff Bar had voluntarily removed its products from the market. So it's pretty clear that all companies that are large and small are ignoring the requirements of pre-market review, and the FDA's efforts at compliance and enforcement are not remotely keeping pace. Hopefully that will change after we move into the next phase of pre-market review. As I mentioned before, after September 9th of 2021, there should be a much shorter list of products that can remain on the market, which should theoretically make enforcement much easier. Next slide, please. So in the meantime, while we're all waiting for the FDA to act, many states and local governments and local communities are exerting their authority to regulate e-cigarettes on their own. This chart summarizes the federal government's regulatory authority over tobacco products, including e-cigarettes, and the authority of states and many local governments. Next slide, please. So for the rest of the webinar, we're going to focus on the policies that states and locals can pursue to protect the public health of their communities. Next slide, please. Before we dive into the policies themselves, let's briefly just review the critical elements of all policies. Next slide. First, there should be findings and a statement of purpose. A finding section sets the evidentiary basis for the policy and explains the rationale behind the policy. These findings both help the public understand why the action is being taken, and it also helps the jurisdiction defend its action in the face of a legal challenge. Next slide, please. All policies should also have a clear, concise, and well-researched statement of authority. The statement of authority essentially explains what authority the jurisdiction or body has to take the action that they're taking. Next slide. It is also critical that there be clear definitions and concise language. So it should be clear to the reader which products are covered. For example, a definition of tobacco products should be broad enough to cover the broad range of products that are on the market now, as well as new innovations. A definition that presumes all products contain nicotine can place the burden on manufacturers to prove otherwise, which could potentially simplify enforcement for the enforcing agency. And policies should also clearly indicate what activity is covered. In the context of licensing, for example, the prohibited activity should focus on the sale of the product by the retailer and not the person buying, using, or possessing the item. Next slide, please. Providing for reasonable and equitable compliance checks procedures is also critical to ensuring that the policy is fair and promotes the health of all communities. The penalties should be appropriate and the appeals process should be clear. If there are multiple agencies overseeing and enforcing the policy, there should also be clear channels of communication and procedures in place for coordination. Next slide, please. And then finally, implementation should include a plan for educating the community and publicizing the policy. This should include a process for receiving, tracking, and following up on complaints. Retailer education is also critical to ensuring that the policy is complied with, as is an effective date that is reasonable in light of the public health rationale behind commercial tobacco control policies. At the end of the day, the most effective policies are going to be the ones that have community buy-in, support, and as Carrie mentioned at the outset of this webinar, are tailored to community needs. Next slide, please. So with that, I'm going to turn it over to Julie to start discussing the specific policies that we address in the playbook.
Thanks, Kira. So I'll be talking about the range of policies we cover in the playbook. So these are effective policy options to end the youth vaping epidemic. Next slide. These policies include tobacco retailer licensing, use restrictions. These include Clean Indoor Air Acts and smoke-free policies, pricing policies, and sales restrictions. And the two most common types are flavored tobacco sales restrictions and tobacco 21. Next slide, please. So a foundational policy structure for addressing youth access to e-cigarettes is licensing. What is licensing? So basically, licensing, a license is issued by a governing body and it gives permission to do something. So a tobacco retailer license issued by the state, county, or city gives a retailer the permission to sell tobacco products. And licensing has numerous benefits. It can be used to monitor and track the tobacco retailers operating within the jurisdiction. So it allows the jurisdiction to maintain a list of retailers. Through licensing fees, for example, it can fund the cost of administering, implementing, and enforcing the policy. It can also allow for the imposition of stronger penalties, such as suspension and revocation. And these penalties we know often serve as a stronger deterrent for violations than simply imposing fines. And it can also allow for the uniform enforcement of the rules, and communities can tailor these licensing provisions to their particular needs. Next slide, please. So we know that vape shops and convenience stores are the primary brick and mortar marketing avenue for e-cigarettes. And we've seen a significant increase in the number of vape shops operating in the United States, from about 3,500 in 2013 to 10,000 in 2018. So like traditional tobacco retailers, vape shops tend to be located near schools and universities and in neighborhoods with high tobacco retailer density. And these neighborhoods, we know, tend to also be at a higher risk for adverse health outcomes. Next slide. So a tobacco retailer licensing policy can help address some of these retailer density issues. Effective strategies include regulating the proximity of retailers to youth-sensitive areas. So for instance, jurisdictions can establish a minimum distance requirement between tobacco and e-cigarette retailers and other youth-sensitive areas such as schools. They can also regulate the proximity of tobacco retailers to each other, so they can establish a minimum distance between tobacco retailers, and they can set a maximum cap on the number of tobacco and vape shops permitted to operate within their jurisdiction. Finally, they can regulate the type of retailers that are permitted to sell these products. For example, they can restrict pharmacies and other healthcare healthcare-related entities from selling tobacco products and e-cigarettes. Next slide. So other commercial tobacco and e-cigarette control policies, such as sales restrictions, can also be incorporated within the licensing policy. So licensed retailers in the jurisdiction can be prohibited from selling flavored tobacco products and also from selling to persons under age 21. Also, the policy can also require that the retailer post signs regarding the minimum legal sales age and also require them to check IDs. Next slide. Currently, over 30 states have laws requiring a license to sell e-cigarettes. So there's certainly room for improvement here. Next slide. So another very important strategy for addressing the youth vaping epidemic are use restrictions. So these include clean indoor air laws at the state level and smoke-free policies at the local levels. These policies are important for limiting tobacco use and reducing exposure to secondhand smoke and e-cigarette aerosol. We know that there is well-established scientific evidence on the significant negative health impact of secondhand smoke exposure, and there's growing scientific evidence that e-cigarette aerosol also poses health risks. So the precautionary principle in public health would counsel including extending the restrictions for secondhand tobacco smoke also to e-cigarette use. And besides the possible negative health risks of e-cigarette aerosol, permitting e-cigarette use or vaping where smoking is prohibited could renormalize smoking and undermine the intent of smoke-free policies and promote an environment that discourages smoking cessation. So policymakers should consider including all products, including e-cigarettes, in smoke-free policies and clean indoor air laws. Currently, 22 states and territories and about 970 municipalities include e-cigarettes in their smoke-free laws. Next slide. So as noted, while many states and local jurisdictions have clean indoor air laws and smoke-free policies, these policies can often be strengthened to explicitly include electronic smoking devices. And one way to do this is to include a definition in the policy for electronic smoking device and to expand the definition of smoking in the policy to include electronic smoking devices. Also, signs should clearly state that both smoking and vaping are prohibited. Next slide, please. So in addition, while policies often cover public places such as workplaces, bars, and restaurants, many policies can be strengthened to cover more spaces such as schools, outdoor spaces, like parks, recreational areas, playgrounds, sidewalks. And also these smoke-free policies can be extended to cover multi-unit housing, which is an area, a particularly important space. Next slide, please. Another highly effective strategy for limiting youth use and initiation to e-cigarettes, as well as for encouraging cessation, are tax and pricing policies that raise the price of tobacco products, including e-cigarettes. And this is because young people tend to be highly price sensitive. The most common type of pricing policy is taxation. It's been shown that increasing the price of e-cigarettes by 10% leads to a 10 to 18% reduction in demand or consumption of e-cigarettes. And as e-cigarette use has increased among young people, states and local jurisdictions are increasingly adopting e-cigarette specific taxes. Next slide. So in developing e-cigarette specific taxes, states and local jurisdictions should take a number of factors into account, and we cover these in much greater depth in the playbook itself. So they should consider which parts, some of the factors to consider, which parts of the device and its components should be taxed. Where should a tax be levied? How should the tax be structured? And what are some of the possible enforcement issues? So we cover these and we suggest best practices in the playbook. Next slide. Besides taxation, jurisdictions could also consider adopting non-tax pricing policies. These are policies that restrict price discounting. Policies that restrict price discounting are very important because tobacco industry price discounting strategies often undermine the impact of taxation. So tobacco companies, we know, spend billions annually to lower the cost of their products through various price discounting schemes, such as coupons, cents or dollars of promotions, buy one, get one free deals, multi-pack offers, and these promotions are typically offered at the point of sale. For example, we know that tobacco companies spend over 70% of their cigarette marketing expenditures on price discounts. So to counter these price discounting schemes, states and local jurisdictions can consider additional pricing policies, such as establishing minimum prices on all tobacco products, including e-cigarettes, and prohibiting all price discounts on all tobacco products. And one example of a jurisdiction that has done this is Benton County, Minnesota. So they prohibit all price discounts on all tobacco products, including e-cigarettes. Next slide, please. So policies restricting the sale of tobacco products, including e-cigarettes, are also very effective in addressing youth initiation and use. And one increasingly common sales restriction strategy are policies restricting the sales of flavored tobacco products. So why restrict the sale of flavored tobacco products, including e-cigarettes? Well, we know that these products are highly appealing to young people. There are over 15,000 e-liquid flavors on the market, and the majority of youth e-cigarette users use a flavored product, and they report that they use flavors, and they cite flavors as their primary reason for using an e-cigarette. So flavors in e-cigarettes is very likely a huge contributor to the youth vaping epidemic. Next slide, please. States and local jurisdictions have the authority under the Tobacco Control Act to impose sales restrictions, and the FDA's limited regulation of e-cigarettes to date offers jurisdictions the opportunity to close many of the existing loopholes. In the cases that have been brought to challenge flavored tobacco sales restrictions, and some of the earliest cases include Chicago, New York City, and Providence, Rhode Island. In all of these cases, the courts held that these restrictions were not preempted by the Tobacco Control Act because they were sales restrictions, not tobacco product standards. So states and local jurisdictions do have the authority to restrict or completely prohibit the sale of tobacco, flavored tobacco products. Next slide, please. Another common and effective sales restriction are policies that raise the minimum legal sale age, prohibiting sales to persons under the age, below a certain age. We know that the majority of adults who smoke begin smoking before they turn 21. This is a quote from an industry document. If a man has never smoked by age 18, the odds are 3 to 1 he never will. By age 21, the odds are 20 to 1. So clearly, a higher minimum legal sales age would likely be very effective in reducing youth initiation to these products. Next slide, please. In December 2019, federal law raised the minimum legal sale age for tobacco products to 21. However, states and local jurisdictions could still consider amending their laws to align with the federal law. Alignment with federal law will provide clarity for retailers, all of whom will be are now subject to this new minimum legal sales age, and it would also ease enforcement for states and local jurisdictions. I should also note that states and local jurisdictions retain authority to raise their minimum legal sale age beyond 21. Thanks for your attention. I'll pass this off now to Megan Kenny, who will talk about her on-the-ground experience adopting and implementing some of these policies. Thank you.
Great, thank you, Julie. I want to start by saying thank you to the Public Health Law Center and the researchers at UNC for having me join the webinar today. I really hope that some of the information I can provide will be helpful for those who are watching and who plan to utilize the playbook. So I'll go ahead and get started. My name is Megan Kenny, and I'm the health educator with the Santa Barbara County Tobacco Prevention Program. We are one of 61 local lead agencies throughout California that is funded by Propositions 56 and 99 and under the direct oversight of the California Tobacco Control Program. Hello to all of my California tobacco partners out there. The goal of our work under the California Tobacco Control Program is to end the commercial tobacco epidemic once and for all, especially among young people and communities disproportionately burdened by commercial tobacco. We aim to do this through social norms change. So we emphasize changing the larger physical and social environments, and an example of this would be adopting and implementing local policies. Today, I'm going to talk about the tobacco control work in Santa Barbara County and connect this back to the major tenets of the policy playbook, so I can hopefully provide a good case study of what the playbook looks like at work. So I thought I would start out by giving you a brief overview of what tobacco policies currently are in place here in Santa Barbara County, before jumping into talking about one specific policy later in the presentation. So in Santa Barbara, we currently have 3 comprehensive smoke-free outdoor air policies, meaning that smoking is prohibited in a number of areas. You'll see I noted that we have 9 policies total, but the remaining 6 aren't as strong and only restrict smoking in a few areas. Therefore, we wouldn't classify them as comprehensive. Following that, we have 1 comprehensive smoke-free multi-unit housing policy, which I'll talk about a bit later. We have 5 policies total, but again, the remaining don't have quite as strong of restrictions. Next, we get into the retail environment. So we have 5 adequate tobacco retail licensing policies. Adequate meaning that the jurisdiction charges retailers a sufficient licensing fee to cover the cost of enforcement. An example of an adequate fee would be the $379 charged to retailers in the unincorporated county that was determined after an extensive and detailed fee study. And an example of an insufficient fee would be $30 charged to retailers in one of our incorporated cities. We now have 4 flavored tobacco policies. These ban the sale of all flavored tobacco products. And in addition to that, we have 4 policies that restrict the location of tobacco retailers, 2 policies that prohibit the sale of tobacco in pharmacies, and 3 minimum pack and price policies. So that's just a quick overview. When looking at California as a whole, I would say our county profile is representative of the majority of the other counties. There are certainly those with more policies and higher grades if you look at the American Lung Association State of Tobacco Control report card, but there are also counties with less policies and lower grades. And I would say this is in no way indicative of the amount of effort and work that is put into tobacco control in those areas. it really is a direct result of, the decision makers and the community that they're located in. So for us, these policies are a result of nearly 30 years of hard work from our program staff, our coalition, and our community partners, as well as the local jurisdictions that adopt and implement these policies. Next slide, please. All right, so this leads me into talking more about our amazing coalition and community partners. These policies would not be possible without them, as I said. The tobacco prevention program here in Santa Barbara serves to provide education and technical assistance regarding the tobacco epidemic and local policy options to the community and to our decision makers. But it's really the coalition that is able to actively advocate for these policies. So when we look at the policy process as a whole from start to finish, really the first place we start is education. And this is the first step in the policy playbook. It's really to know the facts. This means educating yourself first if needed, but then educating your coalition and your partners on the tobacco issues and policy options. It's really also essential to include aspects of capacity building at this step. So these individuals can then go out and educate the greater community and their decision makers. And I think the playbook does an amazing job also of explaining why we need these policies, which is really the first place to start when providing education, simply stating the problem, and we can then provide the solution with the policy options that are later outlined in the playbook. So in early 2019, our community showed a great deal of interest and concern over the youth vaping epidemic and the growing number of EVALI cases. We saw the greatest concern among parents and educators who are often closest to our youth and young adults who are being targeted by these products. Our program staff and our coalition saw a need for increased education given these concerns. And this was also an opportunity for us to partner with new organizations and individuals who've previously not been involved in tobacco, which also helped us grow the coalition and the momentum around local policy work. So the main focus of our community in the early stages was on e-cigarette products, particularly the flavored products, which we know appeal to youth and young adults. There was a lot of education to be done on what the products look like, what the health effects are, how youth are getting access to these products, and so on. But beyond this, we educated the public about the potential to ban these products from the local retail environment, which provided them a mechanism for greater systems level change. But we didn't stop there. Our staff explained the importance of a tobacco retail license to ensure that these policies have an enforcement mechanism. We explained the benefit of minimum pack and price to make these products less accessible to price-sensitive youth. We explained the opportunity to limit the number of stores or proximity of stores to schools or youth-sensitive areas. We explained the ability to ban tobacco in pharmacies, and then finally talk more about smoke-free use policies in public places and multi-unit housing. So as a result, instead of a community and a coalition advocating strictly for policies affecting e-cigarettes, they were going to their city councils and they were demanding tobacco retail licenses, minimum pack and price, density zoning, and more that Julie just outlined for us. So these individuals were equipped with the knowledge and tools to advocate for comprehensive policies, which was really bred from their concern over e-cigarettes. And I think, again, the playbook does an excellent job of outlining all of the available policy options. Next slide, please. So I want to highlight our most recent policy in the county, which is a great example of kind of what I was just speaking about. When the city of Guadalupe showed interest in tobacco policy in early 2020, our coalition and our community partners who had recently just worked on 2 policies in different jurisdictions were well equipped and ready to get to work after all of that education. Our program staff contacted the city and met with them to start to provide education on what a policy might look like. In this case, we provided the city with a draft policy with the help of the Public Health Law Center, who we rely on for the legal technical assistance. We provided them with a draft policy that was incredibly comprehensive. As you can see, everything included on the screen here. It mimicked the 2 recent policies we had in the county with the flavored tobacco ban, minimum pack and price, and so on, but it also included smoke-free public places and multi-unit housing, which was our first comprehensive multi-unit housing policy in the county. So when it was time for the city council meetings, our coalition and partners had organized their letters of support, their public comment. They even created a YouTube video featuring youth and community COVID-19. They were also sure to speak on all aspects of the ordinance, not just what the council knew how in protecting the community. And after a few compromises were made during these policies, the council voted to pass the policy. We've been working with the city administration and the police department on implementation and enforcement. So that's kind of our policy in Guadalupe in a very, very condensed nutshell, is to encourage you to use the playbook to educate yourself and your partners on why policies are needed and what policy options exist. Different needs, wants should be appropriate for that jurisdiction. But it really is in the community's best interest to educate and advocate for the most, because we all deserve the strongest protections from the harmful effects of tobacco. So next slide, please. Okay, I hope everything looks okay. I'm getting some messages the internet's being a bit funky, so I'm gonna wrap up, luckily just in time. But again, I wanna thank the Public Health Law Center and UNC for including me today. I hope that information was helpful. And thank you both to these two organizations for your work in tobacco. Our on the ground work would not be possible without researchers like the team at UNC. I can't tell you how much I look into and reference the literature and all aspects of what we do. And then another big thank you to the Public Health Law Center for their legal technical assistance. And finally, thanks to those who are listening and interested in making a difference. I wish you success in your endeavors. So with that, I will turn it back to Carrie.
Thank you very much, Megan, Kurt, Hannah, Kira, and Julie. This was a fabulous group of presentations. And before we go into our Q&A session, I do want to point out that the playbook is available both at the Vaping Prevention Resource and at the Public Health Law Center's website. All you need to do, you've got the links here, but with the Public Health Law Center, just go into our e-cigarette section and you'll see it prominently posted there. So thank you very much. And we do have several minutes for questions. We've decided we can extend the webinar for another 10 or 15 minutes. So I'm going to start out asking a few questions. We did get a question earlier about taxation in e-cigarettes and whether we were going to get into detail covering that. And I do want to point out that the Public Health Law Center will be offering a webinar on specifically on pricing and e-cigarette taxation next quarter. So with that, let's move to some of the other questions. Is there, and I'm going to ask anybody, possibly Julie, because she talked a little bit about pricing, but anyone else can chime in as well. The question is there a best practice for a minimum price policy for electronic cigarettes, similar to what we see for a pack of cigarettes?
I want to sort of say now, just I forgot to mention this at the beginning of my presentation, is we were simply covering giving an overview in this webinar. So we go into far greater depth on all of these policies, including the various considerations that jurisdictions should take into account. Some of the challenges. So we go into all of these policies in much greater depth in the playbook itself. So I would encourage you to actually to take a look at the playbook. So I will simply present an overview. So I guess that's also part of the answer to this question that we're talking. I mean, the e-cigarette pricing policies are still being developed, and there are a lot of issues to take into account. And I mentioned some of these considerations during my presentation. So we talk about these factors in the playbook, and also offer best best practices in terms of each of those factors. So I would encourage you to take a look at the playbook.
Okay. Thank you, Julie.
I would just like to acknowledge, one thing is, we thought it was complicated with all the different cigarette brands and styles and so forth, but e-cigarettes have such a greater diversity of products, right? Because there's these disposables that are pretty cheap. You have the the products that are the more expensive devices. You have the liquids, and creating a taxing regimen or even just a scheme like in e-cigarettes. I'm sorry, with cigarettes, like in New York City, you can say, hey, we'll have a $13 or a $15 or $16 minimum price, or in other communities, an $8 or $10 price, and for one pack of cigarettes. It's much simpler, and it sounds like someone in the comment that San Diego County, looks like Hudson Kingston, mentioned that they're doing a minimum price. And as a researcher, I love the variety of what you all are doing out there in the field, so we could study it and see what works. Because I just want to acknowledge, I know your work is harder because of the diversity of the products. The same with like I said, the taxing information. And that's why I'm so glad that Carrie mentioned PHLC and others are going to do that, because there are so many complex decisions about the taxation that it deserves its own piece. And thank you all.
Great. Thanks, Kurt. Okay, here's a question, possibly Kira. I could start at least. Have any of you done any work with the multitude of public and private lawsuits against Juul for its role in creating the epidemic of vaping among youth?
So we don't litigate. We don't represent clients. However, we've been following those lawsuits. Some of the complaints are really amazing, really well researched, have a lot of great information. With the history of litigation against the tobacco industry over the past more than 2 decades, I think it's great that so many different types of school districts, jurisdictions, individuals are using the law as a tool to ensure that people are protected. So we haven't been directly involved, but I think they're really important to follow.
Okay, great. Thank you. Here's a question. What support is available for enforcement and implementation of smoke-free air laws? For example, smoke-free multi-unit housing laws. And we have a wealth of resources, of course, on our website. Is there anybody else want to chime in at this point?
So I guess, one of the things, there are a number of considerations in adopting and enforcing smoke-free multi-unit housing policies. As Carrie mentioned, we have a wealth of resources on our website, and the playbook also covers this in quite some depth. But there are unique considerations in this particular setting. One of is because they have to sort of balance the in terms of enforcement, who bears the responsibility for enforcement, and what weight do you give the landlord versus the tenant or the city? And there are equity issues too to consider in enforcing these policies. I mean, part of one of the concerns is, you don't want to sort of, there's a risk of homelessness if you sort of have eviction be one of the penalties. So there are unique challenges in this setting, and so that policymakers have to take into account. And we talk about these in more depth in a number of resources. But I just want to make the point that this particular setting implicates unique challenges that policymakers should be aware of.
Right. Thanks, Julie. And this is a question for Megan. Let's see if I just lost it here. Does the multi-unit housing policy in Santa Barbara cover all multi-unit housing settings, both public and private? Do you know how many units in total?
Yeah, that's a great question. So the multi-unit housing policy was actually passed in one of our local jurisdictions, it is one of the smaller jurisdictions, so it will affect all of the housing properties within that. I couldn't give you a number off the top of my head. I know, as I mentioned, it's a smaller jurisdiction. I would say at least, I believe 30 to 40% of their housing is in a multi-unit setting. And we're really just getting started on the implementation. It's a first for us. So kind of circling back to that question that Julie just answered, we're finding that partnerships with, the city, amongst our department and amongst the stakeholders is really the best for implementation, just bringing everyone to the table. So hopefully that answers a bit of the question.
Thanks, Megan. I actually have another quick question for you. Put you on the spot here. Would you provide a few more details on how you built the momentum in your community to take action on these tobacco policies? Thanks.
Right, yeah. And so I will use this opportunity to highlight my team's work because I wasn't with them at this time. So I don't want to take credit for all of the amazing stuff that they did. So thank you to our team and the fact that I get to brag about what you guys have done. But really, it was a matter of kind of harnessing the focus and concern. And so reaching out to individuals or organizations who, showed any interest in learning more and who required education, and kind of forming new partnerships and using that snowball effect of reaching out to one person and one organization and then being connected to another. And I think it really was important to provide the education that they needed on these products. Like I mentioned, there was a lot of things that people needed to know and wanted to know regarding the safety and health effects, but then going a step further and making sure that they knew that there was policy steps that they could take and be a part of. And so I think, not only did we provide that education that was needed, we provided them with a mechanism to create systems level change in their community. And I think that empowerment just kind of grew, and suddenly they wanted to pull their neighbor in and they wanted to pull their, sports team and stuff like that. So I think it speaks to our community wanting to be involved, but it really just starts with education.
Okay. Thanks again, Megan. I have a question. I'm just going to throw it out to see if any of the panelists have experience with taxation or sale advertising with Native American sales on reservation property.
I can mention I've worked on a study, an analysis of some of the issues a couple of years ago that was published in a public health policy paper. It's really, really complicated, and there's just not enough that has been done, I would say. But there are issues because, as you know, the organizations have sovereignty, and in certain cases, the United States Supreme Court hasn't recognized some of the sovereignty. But also the ability to enforce is much more challenging. So even if a state or local is trying to do something, regulate something, the ability to actually enforce the regulations is really hampered, is one of the key points. Attorneys could maybe comment on that. But this idea of compacts are what's really exciting, is that these organizations, when states work and then the tribal organization gets to keep the money, it's sort of a win-win for both groups, so that the taxes are higher and they're not cheaper, but the tribal organization gets to keep. So these compacts, which are being done, and you see them in Washington State, and we wrote a little bit about it in a paper that I published about 7 or 8 years ago, are really, really a great thing. And I think Frank Chalupka and his team on Tobacconomics, the Tobacconomics website, they have a report that talks about these compacts. So I think there's a win-win way of working together on those.
Okay. Thanks, Kurt. All right, this has been an open question. What recommendations are available for online sales enforcement? And I believe we have a publication on that. Julie, did you want to say anything about that?
So, we have a publication on our site on online sales. I think, enforcement of online sales is a big issue. And what has typically happened is that the attorney generals of various states similar to enforcing tobacco 21 laws. They have youth decoys attempt to purchase products from online retailers, and then they sort of monitor whether or not they are following the age verification protocols and checking IDs. So that has to be a state, because there is nothing on the federal level currently. I mean, we have the PACT Act, which applies to cigarettes and smokeless tobacco, but it doesn't apply to e-cigarettes. So the PACT, so at the federal level, you don't quite have any kind of any real enforcement, quite frankly, of online e-cigarette sales. So any enforcement has to be at the state by state level. And so, I mean, it's similar to enforcing using youth decoys as you enforce with brick and mortar retailers, but of course it's far more challenging with online tobacco retailers. But currently that's really the only option really of enforcing, is having the attorney generals go after online retailers.
Okay, thank you, Julie. And anybody else want to chime in? If not, we'll move. I'd like to encourage folks to write in any of their questions in the Q&A. I have a question. Let's see. What do you think of the use of the public nuisance doctrine in the lawsuits against Juul for its role in creating the epidemic of youth vaping? Do you think it's an effective approach?
So I was actually gonna start writing out a response to that, because I think it's a really interesting and compelling way of using the doctrine. I'm laughing kind of because I have one particular colleague who's really interested in the public nuisance doctrine as applied to these products and tobacco control in general. I think the way that it's framed in some of the lawsuits against Juul is well done. I guess we'll have to see how it progresses. But nuisance has been used in the addiction context with respect to opioids, and there are a lot of environmental harms caused by the disposal of e-cigarettes. So it's not all that, I wouldn't say it's an ill-fitting argument, and we're happy to discuss it further if you want to reach out to us too.
Thanks, Kira. And in line with that, I do want to mention that we will be having a webinar on e-cigarettes and waste early next year as well. So we're trying to keep up on that. I know there's a lot of concern. I think at this point we're going to wrap it up. I do want to let folks know, first of all, that if we haven't been able to get to your questions, we will respond to you by email. I want to encourage you to let us know if you have resources, please let UNC, and if you have questions, legal technical questions, please contact us at the Public Health Law Center. And with that, I want to thank again all of these panelists, Kurt, Hannah, Kira, Julie, Megan, and thank you all for attending our webinar today. Have a good rest of the day. Thank you. Bye-bye.